Have you ever wondered if something as simple as morning prayer could actually change your physical health? Not just your mood, not just your mindset, but your body, your blood pressure, your inflammation, even your memory. It might sound far-fetched. I understand. I was a skeptic myself until I saw it with my own eyes. Let me tell you about Martha. She was 78, a retired teacher, kind soul. She had high blood pressure that resisted nearly every medication I tried. We adjusted doses, changed medications, tried salt restriction, weight loss. Nothing worked well. Then one morning she said, "Dr. Graves, I have started praying. Every morning, just 15 minutes, before the sun comes up, and something is changing. I feel different." I cannot explain it. When I checked her pressure that day, it had dropped. Gently, consistently, naturally. I did not believe it was prayer. I thought maybe it was coincidence. But I could not shake the feeling, so I decided to try it myself. Now, before I tell you what happened to me, let me welcome you if you are new. I am Dr. Elliot Graves. 3 decades, I worked as a geriatric physician, helping older adults not just live longer, but live better. Now, here on this channel, I share the real-world stories, strategies, and science that can help you thrive in your later years. And today, I want to share something deeply personal. I spent 30 days praying each morning first thing after waking, before checking my phone or starting my day, and I tracked what happened to my health. In this video, I will tell you what happened to my blood pressure and stress levels, how it changed the way I think and feel, what it did to my sleep, my habits, and my mood, and how you can try it for yourself, no matter what you believe. But to begin, let us talk about the body. Have you ever felt like your body was stuck in a cycle of pain, stress, or fatigue and nothing seemed to work? That was Harold's story. Harold was 72, a retired engineer, brilliant man, skeptical of anything that did not come with double-blind studies. He came to me with inflammation so severe that he could barely grip his toothbrush in the morning. His joints were swollen, his energy drained. He tried medications, supplements, diet changes. Nothing moved the needle. Then, with some gentle nudging from his daughter, Harold agreed to try something simple, a 5-minute gratitude prayer each morning. I felt ridiculous, he told me. I was not even sure who I was talking to, but he stuck with it. And 3 weeks later, something shifted. His swelling was reduced. His energy returned. His labs showed a 20% drop in inflammatory markers. And here is the science. Prayer lowers cortisol, the stress hormone. And when cortisol is elevated chronically, it wreaks havoc. It inflames your tissues, suppresses your immune system, damages your blood vessels. So when Harold lowered his stress, his body began to heal. I thought, could that happen to me? I have had borderline hypertension for years, 138/85 on average. I started checking my blood pressure every morning and evening during my 30-day prayer journey. By day 14, my average was down to 129/80. By day 30, I was holding steady at 124/78. No change in diet, no change in medication, just 15 minutes of intentional stillness every day. Let me ask you something. What is one condition in your life that might be tied to stress? A racing heart? Digestive trouble? Joint pain? What would it mean for you if that condition began to ease just from quieting your mind? But the changes did not stop with blood pressure. Let me tell you about Sarah. Sarah was 65 when she lost her husband. She came into my office 3 months later, pale, trembling, her voice cracked with every sentence. "I cannot sleep," she said. "My chest hurts. I feel like I am dying." She was not, but her heart was breaking. We diagnosed her with Takotsubo cardiomyopathy, commonly known as broken heart syndrome. Her grief was literally impacting her heart's function. Traditional treatment helped, but not enough. So she created her own ritual. Every morning, she lit a candle, said a prayer of thanks for her late husband, and asked for strength to keep going. The first week, she said, "I cried through every word, but by week 3, I was sleeping again. I could eat. The pain in my chest was not gone, but it did not control me anymore." She was, in a very real way, coming back to life. And the reason is biological. When we pray, especially with intention and emotional connection, our nervous system shifts gears from the fight or flight response to the rest and digest state. It is like hitting a reset button on your stress. During my own experiment, I wore a heart rate variability tracker. HRV is one of the best indicators we have of nervous system. Balance how well your body recovers from stress. By the end of week 2, my HRV had improved by 31%. That is huge. I was not just feeling better, I was functioning better. And here is what struck me most. I felt less reactive, less tense. I could handle interruptions or frustrations without spiraling. What about you? How does stress show up in your life? In your shoulders, your jaw, your digestion? What would it mean to give your nervous system 15 minutes of peace each morning? It might be the best medicine you have never tried. But what happened next caught me off guard. It was not just my body that felt better. It was something deeper, something I had not realized I was missing. Let me tell you about Bernard. Bernard was 81, a retired professor, brilliant mind, widowed. His children lived far away, and he had recently moved into a smaller home. When he came to see me, it was not for a medical issue. He said, "Doc, I feel invisible, like I am slowly disappearing." His blood work showed signs of loneliness. Yes, loneliness leaves a biological fingerprint: elevated inflammation, suppressed immune function, poor sleep. I suggested something gentle, a morning prayer group at the local senior center, not for the religion, just for the connection. He was hesitant. "I am not sure I believe in anything anymore," he said. I told him, "That is okay. Believe in the conversation. Believe in being seen." He went. 3 months later, Bernard was a different man. He had color in his cheeks. He had stories to tell. He caught fewer colds that winter than he had in the previous 5 years. He was not just not alone anymore, he was part of something again. Loneliness, my friends, is as dangerous as smoking 15 cigarettes a day. That is not an opinion. That is from the U.S. Surgeon General. And it is not just about being surrounded by people, it is about meaningful connection, being heard, being known. During my own 30-day experiment, I joined a small online meditation group twice a week. A handful of people, different beliefs, but the same desire to begin our day with intention. By week 3, we were checking in on each other, laughing, sharing small victories and setbacks, and something shifted in me. I felt seen. And maybe you know that feeling, that quiet ache of disconnection. Let me ask you, who in your life might join you in a morning practice? A sibling? A friend? Someone who is also feeling the weight of silence? Because this practice does not just heal the body, it heals the invisible spaces between us. And then there is the brain. Let me tell you about Evelyn. She was 74, active, sharp, but lately, something had changed. "I am losing words," she told me. "I forget why I walked into a room. It is little things, but I notice." Her mother had developed dementia at 76. Evelyn feared she was heading down the same path. We talked, and she decided to try something simple, reciting familiar verses each morning, slowly and mindfully, then sitting in silence, just noticing her breath. After 6 weeks, Evelyn came back smiling. "My mind feels sharper," she said. "I can find my words again, and I do not feel afraid." What Evelyn did not know is that her practice was doing exactly what the brain needs. Prayer and meditation increase gray matter density in the hippocampus, the area responsible for memory formation and spatial navigation. They also strengthen the prefrontal cortex, our center for focus and decision-making, which naturally declines with age. In my own journey, I noticed something I had not expected. I was remembering small details from conversations. I was organizing my thoughts more clearly. I even started dreaming more vividly, something I had not done in years. Have you noticed moments of mental fog? Names slipping away? Tasks taking longer? What would it feel like to have that mental sharpness return even just a little? What if prayer is not just spiritual, but cognitive exercise? And finally, let us talk about momentum. James was 68, a retired truck driver. He had struggled with weight and blood sugar for 2 decades. Every time he made progress, he would slide back. Then something changed. He began praying every morning, just 10 minutes, focusing on gratitude for his body and asking for the strength to care for it. He said, "Doc, I do not know what happened, but I started walking again. I do not want soda. It is like something inside me woke up." 3 months later, James had lost 22 pounds. His A1C had dropped so much, we reduced his diabetes meds. That is what I call a virtuous cycle. One good habit begets another and another. In my own experiment, I noticed I was naturally reaching for healthier foods, drinking more water, taking short walks to clear my mind. And my sleep? improved by 40% according to my tracking device. Prayer does not replace other health habits. It supports them. It gives them roots. So let me ask, what is one habit you have struggled to stick with? What if the missing ingredient is meaning? Now, if you would like to try this for yourself, here is a simple framework anyone can use. One of my patients, Maria, 84 years young, created it. She called it her GRACE method. Each letter stands for a step. G, gratitude. Begin by naming 3 specific things you are thankful for, big or small. R, request. Ask for help, strength, healing, peace, guidance. A, affirmation. Say something kind and true about yourself. I am healing. I am strong. C, connection. Take a moment to feel connected to your body, to a higher power, to the earth beneath you. E, embodiment. Place your hands over your heart. Take 3 slow breaths. Feel your body come alive. Maria practiced this for just 12 minutes a day. After 1 month, she said her chronic pain had lessened. Her daughter told me, "Mom is laughing again." In my own version, I used a timer for 15 minutes. I sat by the window, no phone, no background noise, just me, my thoughts, and the breath. You do not need to be religious. You do not need incense or candles. You need presence, intention, a few moments of silence. Let me ask you, what would your grace practice look like? What would you say during those 15 minutes? Now, let us take a breath and recap what we have learned. Daily prayer can lower your cortisol level and reduce inflammation, improve your blood pressure, immune function, and sleep, activate your body's healing mode instead of stress mode, create meaningful human connection that protects your health, enhance memory, focus, and mental sharpness, support other habits like better eating, hydration, and exercise. But most of all, it reminds you that your health journey is not just about prescriptions or lab results. It is about wholeness. You are more than a number on a chart. You are body, mind, and spirit. And when those parts are aligned, healing becomes possible. So here is what I invite you to do. Try it just for 7 days. Set aside 10-15 minutes each morning. Use grace or create your own rhythm. Then come back here and tell me what you noticed, what you felt, what changed. And if you found this video helpful, please tap that subscribe button. It helps this channel reach more people who need encouragement, healing, and hope. Tell me in the comments, what is your experience with prayer or morning routines? Are you already doing something that helps ground you? And in the next video, I will share the exact 5-minute prayer one of my patients used to lower her blood pressure more than any medication we ever prescribed. It is simple, it is beautiful, and I think it will surprise you. Until then, may you be well, may you be at peace, and may you never forget you are not alone on this journey. This is Dr. Elliot Graves, and I am honored to walk with you.